Good morning, everyone. My name is Schneider. I'm one of the WIC consultants at the State WIC office, and I want to welcome you to the Income Eligibility webcast. This is kind of an unusual webcast in that we've recorded the content, and so I want to make sure that I remind you that you can always click on the questions button when you or your staff have questions about a particular area, and then we'll come back live in a few minutes. At the end of the presentation to answer your questions. So you'll see the pre-recorded information that we initially presented during the WIC conference last year in 2015. And hopefully this will be helpful for you, and it will be posted on our training website so that you can access it for new staff or for staff who want to go through the eligibility steps again. So hopefully you'll enjoy the webcast. Thanks. Welcome to the WIC Income Eligibility Road to Success. My name's Terry Riemenschneider. I work with the Michigan Department of Health and Human Services WIC division, and wanted to talk today about the eligibility process for the WIC program. So we're having technical difficulty at this point, so we want to just go ahead and broadcast live for you. So the purpose of this training is to review some of the policies and guidance that we received from USDA on WIC income eligibility determination. And really the goal is, no matter whether you're in Marquette or Monroe or Manistee, that you have the similar process for determining eligibility for your clients. So we want to make sure that we're doing that accurately and quickly with adequate documentation within the MyWIC system. So we've received some income guidance from USDA over the last couple of years, and we're really doing this in preparation for an audit that's planned for all the states in the next little while. One of the things we're going to be really focusing on is the compliance with USDA guidance. So as we're looking at ME season next year in 2016 and forward, that some of these new interpretations that have been provided by USDA are implemented in the clinics. Just want to also have a chance to run through some of the eligibility policies, a summary of the policies, what are the documentation requirements that are part of that, and of course get to your questions. So why? Why was USDA interested in income eligibility? The USDA commissioned a Government Accounting Office report. The GAO report noted inconsistent income determination practices in WIC throughout the WIC programs in the nation. They were concerned about fraud and abuse. You've heard a lot from us about fraud and abuse, and one of the things that they noticed was that there was a lot of variability in the way that states were looking at income eligibility. And WIC receives the most discretionary funding of any USDA program, and so there's a lot of concern about fraud and abuse in the WIC program, and USDA and Congress wants to make sure that fraudulent issues are being dealt with and trainings are being taken care of. So what is involved in program eligibility? It really looks at income eligibility and verification, and I've listed the policies there, starting with policy 201, which is kind of the overview of all the eligibility policies, and then 204 really digs into who is income eligible and how do I determine that. 2.05 goes over the income guidelines in terms of actual 2015 up-to-date income guidelines. 206 and 208 look at proof of ID and proof of residency. So some of those things really pertaining to the WIC program. Adjunct program reporting and policy 2.06, that's really dealing with income, and then looking at identity verification and residency. The rest of the certification, of course, includes the risk determination, anthro and lab measurements, health and diet history, referrals, and nutrition education. So eligibility is just one part of that important process that you use. We do have our WIC policy manual, and all the policies that I'll be referring to are posted on that michigan.gov/WIC. If you click down and look for the WIC providers section, you'll see the WIC policy manual posted, and we're one of a few states that has that posted right on our website. We also offer the WIC consultant du jour, calling our 800 number, pressing 1 and 2 if it's a policy issue. It is helpful in terms of finding out what your issues are, what your questions and concerns are, and also helping you address those. If it's a MyWIC issue, of course, we have you press 1 and 1 and talk to our colleagues in Maryland about at 3 Sigma in terms of the system issues. So let's begin talking about the intake policies surrounding the certification process. Through the next few slides, I'll highlight information we frequently get questions about or see management evaluation citations. So we're really trying to focus on what are the issues that USDA is trying to bring forward. Also, what have we noted as far as training points from our MEs. So the other thing is that just talking about the no proof situations, you should short certify clients who don't bring proof with them. When following client-centered principles, we don't turn clients away if there's a way to provide services that day. So that's something to keep in mind when you're processing clients as much as possible. So dealing with policy 2.02 talks about residency. Now let's talk about the various proofs required for certification. So Michigan residency is required at the initial enrollment or transfer of a client and at each subsequent certification. There are some clients who do not need to bring proof with them. These include homeless individuals, military or migrant families, transfers who have a current VOC, someone who has recently moved to the area, and victims of theft, loss, or disaster. For these clients, we can ask them to review and sign the no proof of residency attestation form. So we have a couple different things that we have available to us. The other thing to remember is that if you have verified a client's enrollment in the Medicaid program, which more than 70% of our clients are enrolled in, then that verifies Michigan residency. So that's information that is very helpful if they didn't bring in their proof of residency. So here is a list of some of the proofs that are allowed, and also again for the no proof required. So you can see that right there that we do allow the Michigan ID or driver's license, the voter registration. a mortgage receipt or rent receipt, a passport or visa that has the client's address on it, a homeless shelter address, a My Health card, again, a current Medicaid ID, and other things if you can determine that that is adequate to establish residency. Some people have a pay stub that has their address on it. So again, it can be what the client has available to them, and so that you can go ahead and process the proof of residency. So again, we talk about some special populations that don't require the proof, and want to make sure that we provide services to those folks as much as we can. So the next one is proof of ID. Proof of ID is required for each client at the initial certification and when you're transferring into the WIC program. For each authorized person, proof is required at that time, and also when they're in the clinic for benefit pickup. So if you have a client that you're issuing benefits to, we need to verify that that's the person that we intend to provide benefits to. Again, if identity proof is not brought in, the client may be short certified for 60 days, and that homeless individuals, migrants, victims of theft or loss are not required to bring proof with them. And again, they can provide a proof attestation form if there is a situation where they don't have proof available. Once a client's ID has been established, personal recognition by staff is allowed. Also, if a client forgets to bring proof when they're picking up benefits or something like that, again, you may be able to use a comparison with their signature on their certification forms, or and again, recognition is allowed. Here we list the identity proofs that are in our policy. You may also use some other records that would be available to you and to the client to verify identity proof. We do require that the client who's newly enrolled brings in proof of ID, and recognizing that, you know, a newborn may only have hospital information, or they may have proof of ID that's based on their immunization record or something like that. Hospital bracelet, crib card, any of those kinds of things can work for our newborns. And if it's not brought in, again, we can short certify that client for up to 60 days. Do want to suggest, if you do short certify someone for lack of proof, that you go ahead and make an appointment within that time frame so that they don't go without benefits for the future. Next policy I wanted to talk a little bit about was the income determination policy, which is 2.04. Published in the WIC regulations is the maximum allowable income is 185% of poverty level, and again, that's addressed in policy 2.05, or income guidelines policy, unless the client qualifies as adjunctively eligible. So we'll talk about adjunct eligibility in just a moment. Income must be verified. It has to be a tax stub, tax form or a pay stub. And again, you need to record the income that's been provided in the income information screen. Adjunct eligibility, again, we document that with the client agreement and the Medicaid verification screen. The migrant, homeless, or works for cash and has no verification of income, we look at the policy and provide the no proof of income attestation form for most of those clients. If the client has no income, again, when they sign the client agreement, they say that they are providing accurate information for us, and so no attestation form is needed for that. So we have the income rules that pertain to WIC eligibility. If a client has proof of income but didn't bring it to the recert or cert appointment, if they're adjunctively eligible, you can self-declare income, and they can be fully certified. Otherwise, we need to short certify that client, and we can provide up to 30 days worth of benefits. After that, they'll need to provide proof to you to be able to extend their certification for the whole certification period. There are separate rules for migrant families, and that they have income determined every 12 months. Most of our clients have income determined every 12 months anyway, but if a migrant family has moving to Michigan WIC, and they've had their income determined within the last 12 months. We don't have to do it at the time that they come in to enroll. And for children that are coming in for infant evaluations or child evaluations, and there's no other family members, we do not have to evaluate income at that time. That's one of the things that we like about that I-eval, C-eval process, is that it's a streamlined, jump right into the measurements and the update for that client. But if another family member is being certified, you may have to determine eligibility for that client, and that may affect whether or not your client, your C-eval or I-eval client, continues. So what's the definition of income according to USDA? It means gross income before deductions for income tax, Social Security, and insurance premiums, etc. It does include overtime pay, and if the client has been self-employed or farm income, in this situation we use net income because farm expenses and self-employment expenses don't really reflect what the client's true income is. So again, if you want more detailed step-by-step information about what is allowable for proof of income, what are the requirements, then you'll review Policy 2.04. We have a couple different ways that we calculate income. The most common is probably looking at the client's current income. So that's the past 30 days rate of income. And so if a client brings you 2 pay stubs that are 2 weeks of pay period, that would provide you with sufficient income to be able to look at that, average those incomes, and record that information on our MyWIC system. For some clients, we have an annual income really reflects their income better. And these might be clients who are construction workers, farmers, seasonal agricultural farm workers, self-employed people, or people on leave due to an illness or childbirth. So really they have a fluctuating income or kind of circumstances that is interrupted income or some other thing where annual income really reflects their income more accurately. So then we have income over the past 12 months, and you can use a year-to-date income that's been annualized, or income is stated on the most current IRS 1040 tax form that has been filed. So again, we can use that income tax form until the next one is filed the subsequent year. For families that are experiencing temporary low income, that is a situation where we look ahead 30 days. So a client has been laid off or is on strike or has a seasonal kind of situation where they are not working consistently, or it might be someone who's gone on a maternity leave, that their income for the next 30 days is going to be drastically different than their usual income when they're working. So in that case, we look at the future next 30 days and what their actual income is or their anticipated income is for the next 30 days. So if you're using the year-to-date income, we do have a special feature on our screen to be able to do that. And let me just roll that information here. It's going to kind of walk through and talk through that income eligibility process. So we start on the family information screen, and whoops. Oh, it's not going. Okay. Start on the family information screen, and on the income information screen you have a year-to-date feature that allows you to put in the year-to-date income information, and for that client then the system will calculate what the year-to-date income is based on the number of weeks that have been worked and then the number of weeks that we anticipate for the future for the year-to-date income. So if the income's not been employed, if the client hasn't been employed since the beginning of the year, you're going to have to manually calculate the income using the number of weeks employed and divided by the total pay to date, and then multiply that times the number of weeks or months that are in the year. So then you'd multiply that by 52 weeks or 12 months, however you calculated that income year to date. So we were talking a little bit about Policy 2.04, what income sources should we consider? Of course, wages, salary, tribal per capita payments, overtime pay, all are included in the wages area. Most military pay is included as the income source, but we'll have another slide that talks a little bit about military pay in particular, because Congress has exempted some military pay from inclusion in the WIC consideration. Net income from farm or self-employment, and there you need to look at the IRS 1040 form Schedule F or C for farm or self-employment. Social Security benefits are included. Dividends, interest, tax savings, bonds, income from trusts or real estate. Public assistance for our WIC clients, it would include the FIP, the Family Independence Program, or cash benefits, but it would not include the SNAP benefits that they may get on their bridge card alongside their cash benefits. Government, civilian, or military retirement, pensions or veterans payments, pensions or annuities, alimony or child support, contributions from persons not living in the household. Someone may be providing regular benefits to a client, net royalties or other cash income, and that can be on a one-time basis or on a regular basis, depending on what's the client's circumstance. So again, here's where we have to use our client-centered skills, listening to what the client's telling us, listening to their story, because it may be very different from one client to another. So when considering military pay, there are income sources that do and do not apply for WIC eligibility. So if we go over the list, what does count are things like base pay, basic allowance for subsistence, foreign language pay, family separation pay, jump pay, dive pay, sea pay, flight pay, and things like the cost of living allowance for the U.S. If you have a client that's being paid for their clothing maintenance allowance or bonus pay or special pays, that may be on one paycheck for that you are looking at. And if it's sort of a year-to-date kind of situation, then those that income can be averaged over the course of time. So that may be helpful. I know military pay stubs are very complicated and differ between the services. So just when you think you've got it under control, you get a Coast Guard pay or a Air Force pay, and it looks totally different than the Army pay that you may have been used to. So I also want to cover what does not count. So these are specific exemptions that have been named by Congress. It does not count if the client is reimbursed for basic allowance for housing. So that's listed as BAH or BAQ on the pay stub. Family separation housing, family subsistence supplemental allowance, overseas housing allowance, overseas continental United States cost of living allowance, combat duty or combat zone pay. And so you can see that the client might be presenting a stub that has dive pay or sea pay, but if it wasn't in combat duty, then that does need to be considered for income. However, if combat duty included combat dive pay or combat junk pay or flight pay, then that should be exempted from your consideration of income. So it's complicated. If you run into some questions or problems, then give us a call at the 1-800 and talk with the consultant du jour about what is covered and what isn't. And again, this is covered, and you'll find this in our policy under 2.4a, talking about military pay. Some of the other things that we include as income exclusions, in-kind housing or other in-kind benefits that a client might receive. So I'm living with my sister, she doesn't ask me to pay rent, I can consider, but I'm earning income, I'm taking care of my own bills and that kind of thing. I can be considered my own household even though I'm receiving free housing. Loans, payments or benefits provided under federal programs, and you can see the list of programs which continue on from page 4 through 7 in the policy. So there's quite a few exclusions, not many that you'll run across. So that does include VISTA or foster grandparent payments, payments through the Job Training Partnership Act, school lunch benefits or child care feeding programs. So anything that has to do with school lunch or child care feeding would not be included. payments from Low Income Home and Energy Assistance Act, school financial evidence, and then those kinds of things are also included here. Funding by Title IV, including the Pell Grants, child care payments under the Child Care Development and Block Grant, National Flood Insurance payments. All these things are excluded, and again, you can refer to the policy for other programs to make sure that you're including what needs to be included and not including what doesn't need to be included. So when do I verify income? We do income verification at certification, recertification. Again, we talked about that no income determination is needed if a client is coming in for an infant eval or a child eval appointment, or if they're transferring to the WIC program from with a current IDVOC and current certification. The income guidelines, we do publish those as part of our Policy 2.05. They're also available here on the income information screen. If you click on the guidelines, then the current guidelines will pop up. So you have that information, annual income, monthly, twice monthly, bi-weekly, weekly income, and so that's available right in your MyWIC system. If you have a call or you have a client that you're concerned about whether they're in the guidelines, you can pop those right out. We also published the income calculation reference sheet, and I believe that's in also an attachment to our Policy 2.04, and again, this gives that information, annual, hourly, weekly, biweekly, monthly, and we update that information on an annual basis as soon as our policy is published. The other part of this income guidelines help sheet that you get is the income calculation reference that includes the table and also looks at other programs that the client may be eligible for, provides you with the information on eligibility for those programs. Enrollees on programs with the person figure on them, so you can see that little person figure, do have adjunct eligibility for the WIC program. So these are forms of Medicaid, and so those clients would be automatically income eligible and adjunctively eligible for the WIC program. Even though, if you look over here in the column for Healthy Kids and Moms program and the coverage for infants and pregnant women, it actually, the income guidelines for that program extends up to 195% of poverty level. But because it's a Medicaid program, the federal regulations allow us to consider those clients as adjunctively eligible. We have received some word recently, but it's not in effect yet, so I probably should just kind of say this under my breath, that the clients enrolled in My Child will be rolled into a Medicaid program over the course of the next several months. So you may see some of your clients who formerly had a My Child benefit that would be adjunctively eligible for the WIC program, and they anticipate that all those children will be converted into a Medicaid program come January 1st, 2016. So more details on that as we go towards the first of the year. So clients enrolled currently on My Child, we do need to do an income verification for them because currently the income guidelines do extend to 212% of poverty level that they qualify for that program, and so not all of those clients would qualify for WIC. So those we have to qualify or verify for income. Just comparing two that we kind of have put in, you know, if you have these clients that are enrolled in the programs, that just to be able to say, okay, who's the same as WIC or included in WIC eligibility, so you can see that information as well. So what is adjunct income eligibility? That means that the client is eligible based on enrollment in another program that verified the client's eligibility for that program. So it's using their rules and their requirements, And WIC can take advantage of that and speed the client along by using that previously verified information. So for Medicaid, Healthy Kids Program, the Healthy Michigan Plan, the MOMS Program, Family Independence Program, and SNAP enrollees, those clients are automatically eligible for WIC certification. Clients who have enrollment in Children's Special Health Care Services, My Child, free or reduced price lunches, must provide proof of income, or if income was determined here at the WIC agency, you can use that information, but those programs have a more generous guidelines, and so therefore the client still needs to be under that 185% of poverty level. So again, the adjunct eligibility, if the client received Medicaid, Healthy Kids Program, Healthy Michigan Plan, SSI, MOMS presumptive eligibility, or is enrolled in the Cash Assistance Program through FIP, if they're a member of a family that has SNAP, receives the Family Independence Program cash benefits, or contains a member who is pregnant or an infant who has Medicaid. So if the family member has Medicaid that's pregnant or an infant, then the whole family is adjunctively eligible based on WIC rules. So what if a client is adjunctively eligible? Really, that's the fast lane for WIC enrollment. A verbal statement of income is allowed. The current Medicaid also, if they provide you with proof of residency, that adjunct eligibility. And if the client brings in their Medicaid card, it also provides you with proof of ID. So if they actually bring in the card, you're in really good to go because they have all of the required proofs except for proof of pregnancy if they're a pregnant woman. So I have to tell you that I have some really fancy animation slides that are built into this system, into the slide presentation, but we can't display those today. But when you go to review this information on the website, those will be active and available to you. So I just need to say that, and sorry about the technical difficulties here. So how do we verify Medicaid eligibility? We pop up the adjunct eligibility screen, and here we're able to click on the Verify button. If the Medicaid ID number is present in that, you click on Verify, and the system, my WIC system, goes over to the CHAMP system, which is the Medicaid Eligibility and Verification System, looks for that client ID and says, aha, this client, yes, indeed, is income eligible, or is a current enrollee on the Medicaid program, and so therefore we can verify adjunct eligibility. For clients that, again, would be a pregnant woman, you'd want to, if you have the choice, to click on the pregnant woman or click on the infant's record first with that Medicaid ID, then the whole family would be verified adjunctively eligible if those clients have adjunct or have eligibility. This example is a pregnant woman in the family, so the entire family would be adjunctively eligible. If there's no pregnant woman or infant in the family, then you have to verify each child's income or each child's Medicaid to be adjunctively eligible. On this screen, we'd also report that whether or not the family was enrolled in food stamps or receiving cash benefits. And here, even though we have a verify box that's in existence, there's nothing to link it to. So basically, if you're going to report yes or no that the client is enrolled, you click on Verify. You can put in the family ID for that client. It will try to verify, but you verify that manually by going to the Xerox verification process on the phone to see that that client has received a deposit that month in their food stamps or their cash benefits accounts. So that's a way of being able to do that. We also see on that screen if a client reports that they're not participating in any program, Medicaid they're not participating in Medicaid or food stamps or FIP, then you can click there and all the members of the family will be marked no in terms of the reported involvement in those programs. If the family says we're not involved in any DHS, Medicaid, food stamp or FIP program, you can click here, and again, all of the clients that you have checked will be marked no. What else can we do to verify enrollment in food stamps or FIP is, again, contacting using the phone number, the automated system. The client may also have an online access to their records, and again, what you need to verify is that the benefits were loaded during the current month, not that they have existing balance, because the balance can be retained with food stamps or with the cash benefit program, and but what we're looking for is actively being enrolled in the program, and therefore we'd need to see that deposit. We have a new option for client is to apply for presumptive Medicaid eligibility with a quick online application. If the application is accepted, the client is immediately accepted for coverage for 60 days. So that allows them time to complete all the proofs and provide DHS with all the proofs that are necessary for a full Medicaid application. Then they must submit that full Medicaid application within the period to extend their benefits. So this is a wonderful way for our clients to get coverage immediately and then apply for the full Medicaid application, which looks for other eligibilities, so you get the coverage and the future eligibilities as well. So you might see clients who have a designation of presumptive eligibility, and that will give them that 60-day coverage. Health Department and other organizations can assist clients in enrollment, and if a client has presumptive eligibility, this represents a manual verification. So if they come to you or you've assisted them with this process and they have they get this congratulations notice, then we can presume that they're eligible for Medicaid. They may not have a Medicaid ID number, however, so that would be a manual situation. Another program that provides adjunct eligibility to the WIC program is for Plan First. Plan First has been extended to provide family planning coverage to clients not eligible for Medicaid and whose incomes are 185% of federal poverty level or less. And if you have further information that you're needed to be able to provide your clients, you can go to that website that's posted here, and your client can get more information about what's available. And they should have a benefit letter for enrollment in Plan First. So we talked a little bit about people who have income, who have adjunct eligibility, but what about the client who has no proof of income? This is important for clients who are not adjunctively eligible, because obviously if they're adjunctively eligible, we don't need that proof. A verbal income is all that's required. So let's look at clients who are not adjunctively eligible. If they have proof available, but they didn't bring it, we can go ahead and perform the certification, document that we have no proof of income at the time on the Income Information tab in the verification column. And this will trigger a short certification where the client needs to provide proof of income within 30 days. If the client has no proof available or it doesn't exist, for example, if a client is receives cash income or is a migrant or a homeless person, they can attest to their income and document on the attestation form why they have no proof. Oops, sorry. If the client has no income, they can self-declare that they have zero income. The MyWIC system will offer a pop-up for further screening to determine if this client is a member of another household and or needs additional screening for needed referrals. So a client who declares no income, again, they may have some other needs, or they might be a member of another household. I've included as part of your materials for this webcast a no proof scenario. Some people have, or we've used this for our trainings in the past, and people have found that this has been helpful in circumstances where you're kind of, okay, well, he doesn't have proof for this, what do I do? So this is available in the resources today. I see them posted when I go out and visit clinics. So and basically we're just trying to say, okay, here's some common situations, and then we can see whether or not an attestation is needed, what the drop-down values are that need to be entered in the system, whether or not that triggers a short certification, and what follow-up is needed. So hopefully that's a helpful tool for you who are doing income information. And especially if you have a new staff member, please share that information with them. So here we're looking at the income verification screen, and the income determination is based on the client's family size and their income. If the family has income but didn't bring proof, then we short certify them. The short certification period for no proof of income is 30 days. The system automatically assigns that. You may issue 1 month's worth of benefits, and the clients must then provide proof of income to continue with WIC service. Here we have the declaration of no income. Again, the client states they have no income. So we put in the system that the source equals no income, and this triggers that further screening. So these are the questions that will pop up on your MyWIC screen to let to ask the client. Again, we want to make sure that we're doing that in a client-friendly way to see is the client, maybe perhaps a member of another family, or whether or not they need to have additional services through referrals from the WIC program. So let's talk about family size. According to the USDA, a family is the number of people supported by one household income from all sources. Any unborn children should be included in the family size if the family includes a pregnant woman. Also, adopted children count towards the family size. For family members who are living in an institution or group home, if the family pays support for the member, the person should be included in the family size. If support is paid by the state or another entity, do not include that member in the family size. A family living in a shelter or other group residence are considered a separate family from other residents. So you can have multiple families within one dwelling, and that's how I kind of look at it, is that the family is really who I'm responsible for financially. Foster kids are not included in the foster family size, but are each a family of one. And that goes into the foster process that we'll talk about here in a minute. So just to reiterate, we have a pregnant woman, and we do count in the family the number of expected infants. So a pregnant woman with twins would actually be a family size of 3, regardless of whoever else is in her family. She's 3 people to start out with, so she gets an extra bonus for the number of fetuses that she is gestating. So here again is our definition of family, a group of related or non-related individuals who are living together as one economic unit. And except that residents of a homeless facility and an institution are not considered as members of a single family. Family members share income and goods and services. More than one family can live in a house or a dwelling. And the biggest thing is that a family must have its own source of income or support. Otherwise, you're kind of wondering, well, how is this family managing, and are they part of another family if they're managing without that? Another policy we wanted to talk about was physical presence. Most clients should be present when certification occurs. This prevents problems with having mismeasurements or other things. And there may be instances when the client cannot be available, or it would cause a significant barrier. Local agencies may opt to certify infants under 8 weeks of age without their presence in the clinic. In these instances, the local agency may require verification of the existence of the infant, and you might want to bring these clients into the clinic within the first 2 months for growth and nutrition assessment. So right now, we can enroll infants on the program up to 8 weeks of age based on their hospital data. But again, if they're breastfeeding, or if you're trying to monitor how things are going as far as the baby's eating and feeding and growth, you may want to have them bring the baby in subsequent months so that you can make sure things are going well. Here are some of the reasons that are allowed in the policy for exceptions to certification being, or clients being present at certification. Obviously, if a client has a medical condition that requires equipment or is not easily transported, a condition that requires bed rest, a serious illness where the client is prohibited from coming in contact to the public. Again, we allow infants under 8 weeks of age. If also in terms of convenience and availability, if the visit presents a barrier and if the client has been present at the initial certification or previous certifications and has documented healthcare information. So if they went to their doctor last week for a preschool physical and they have the weights and measurements, they have the blood work that you need, the client wouldn't have to be picked up from preschool, brought into the WIC office for that recertification. If the parents or caretakers work, if that presents a barrier, so for example, again, maybe mom works right here in town and would have to leave work early, go home and pick up the client, bring them back in. If they have that current information and the client was present within the last year, we can make exception there. Also, if clients who are visited or screened at home or in another program, so if you're working in conjunction with MIHP or another home visiting service, then the client, and you have CPA qualified and trained staff, then they can be enrolled in the home and provided with benefits as the staff member returns to the WIC office. So how do I document the presence? If we go to that CERT action screen, it will automatically mark that the client is present for CERT. So if they're not present, you have to uncheck that, and then it will give you opportunity for a drop down to record the reason for not present. If it's not one of the ones that is there and you say other, then a note is needed for you to document in the client note, and that's the little notepad icon that you see on the top of your screen over here. So again, you can note in that note why the client wasn't available. So let's shift gears to some of our other intake policies for a few minutes. In an effort to reach all pregnant women during the first year of pregnancy, any woman who claims that they are pregnant needs to be enrolled. So we can go ahead and take that information, we can go ahead and enroll her even if she doesn't have proof of pregnancy or isn't visibly pregnant. And again, that triggers then a short certification for 60 days, and we would expect to have either proof from a peer's pregnant point of view or other ultrasound or some other kind of proof by that 60 days. If you have a client who's being enrolled after a miscarriage who is as an NPP, if proof of pregnancy or miscarriage was provided, they can be enrolled. So if you had proof of pregnancy during the pregnancy, or the client provides you with proof of pregnancy and proof of miscarriage after the pregnancy, then we can enroll her for 6 months post miscarriage. So what kinds of proofs are allowed for proof of pregnancy? And we document that on the client information screen. They're listed here, and again, we just want to make sure that women get enrolled as soon as possible, and so if they have no proof, again, we can record that and document, and that will trigger the short cert. So going back to miscarriage for just a second. Clients who report having a miscarriage or an abortion while they were who've ended their pregnancy in some way are entitled to pregnant benefits for 42 days after the end of the pregnancy. At that point in time, they need to be recertified as an NPP, and their certification end date will be 6 months from the date the pregnancy ended. We do have a postpartum miscarriage health history form, which might be a little bit more sensitive for the client who's ended her pregnancy or whose pregnancy is ended. And so that might be helpful. And again, you see the web address of that health history form, which might be, again, something you can have on hand or utilize when you need it. Again, what we need for this client is a verification that they were pregnant at or that they miscarried. So no, if they proof of pregnancy is in the record, then no further proof of pregnancy is necessary. So let's go on to the next policy where we talk about foster care eligibility, foster child eligibility. So foster children are always considered a person of one-person family, and we know that if they're in foster care, then Department of Health and Human Services is legally responsible for the child. So they're legally responsible for the child, their placement, their medical services and care, which they've entrusted to a foster parent. Payments made to the foster parent or foster family are considered income for the foster child. And we know that there are some foster children that are placed in family members with family members, and that foster supplement may not be offered to those families, or those families may decline that as a foster payment. So the client may say, I just don't get anything from the state, and again, we would record zero income for that situation. If custody changes for that client, if we can remove the benefits from the previous family, and then therefore we can provide benefits to the child with the current family. If you're not able to remove the benefits for the former foster family, we can still go ahead and authorize benefits to the child with the current family, but you may want to contact the previous agency and let them know that the client has moved on so they can go ahead and void those benefits. If you have a situation where a foster child is then adopted, the child becomes and is counted as a member of the family. So an adopted child is always a member of the family. A foster child is always a family of one, even if there are siblings in the same foster family. So here again is one of my wonderful slides that you'll be able to see in the demonstration as you go on the website, but won't be able to show you here. But let me just click on or point out that here's where that foster child would be found. So we go ahead and click here and click go, or select the foster child if there's more than one foster child in the option. Click go, and the income information, the adjunct eligibility screen, the client information, the additional information screen would pertain to that foster child. So that's what we need to do to trigger that foster child. On the pre-cert screen, we have a way of being able to designate someone as a foster child. Also on the client information screen, if you go back over here, you can designate or undesignate a client as being a foster child. So that's where you can do that if the child's already been recorded as a foster child, or if the child is just becoming a foster child. You can go to that client information screen, pop that up, and you'll see a button there, or a checkbox there that you can check for foster child. And then you'll see the foster child in the family or see that child listed in the family as a foster child. Okay. The next policy talks a little bit about migrant families. There are specific requirements for migrant family eligibility according to USDA. Again, when we're looking at vulnerable families throughout the WIC program, migrant families are especially vulnerable because they're moving, because they may not have context within a community, because they may have work, may not have work. It can be a very tenuous kind of situation, and so that's one of the things that USDA recognizes and why we have some of these special rules. So if a client is designated migrant upon enrollment, we need to make sure we're verifying migrant status at each certification. Clients do settle out. They find Michigan helpful or find jobs in Michigan, and they then kind of leave the migrant lifestyle. If they do that, they have a 2-year period where we continue to consider them as migrants, and then after they've settled for 2 years, then they're no longer considered migrants. And again, on that family information or pre-cert screen, you can designate someone as a migrant, and if you go to the family information screen, I believe it's on the additional information, you can check or uncheck migrant, whether or not they're currently in migrant status. Again, we talked about that the migrant families only need to do not need to provide proof of ID or residency. Again, they need to sign the no proof of ID or residency attestation form if they don't have proof of ID or residency. We need to give them priority appointments. Hopefully we could certify them or provide them with transfer information within 10 days or immediately if at all possible. We need to verify their income every 12 months. Again, documentation is not required for certification, so they can self-declare. And again, we can use the no proof of income attestation form if they have no proof. The verification of certification, or the VOC, can be accepted for a migrant family. And again, if the income was determined within the last 12 months, we don't have to do the income for that family, even though they might need recertification for their family members to continue with WIC. And again, we want to make sure we're providing the Michigan VOC to migrant families so they have proof of WIC enrollment as they move with the crops. Wanted to talk a little bit about certification periods. Those are determined by USDA and they're kind of programmed into the MyWIC system, but sometimes people have questions about that. For pregnant women, the estimated date of delivery plus 42 days. If you have a client who is very early on in her pregnancy, she may not have a firm EDD established yet. And if it turns out that the client actual or estimated date changes significantly and would be past that 42 days, you need to notify us here at the state or at 3 Sigma, and they can make a request to extend the certification period through the end of her pregnancy. For breastfeeding women, our cert periods are 1 year past delivery date. Non-lactating women, postpartum women, and that can be including the miscarried woman, 6 months past the delivery date or the end of pregnancy. Infants under 6 months of age are a 1 year cert up to the first birthday. Infants who are certified at after 6 months of age, it's really a 6-month certification period first, and then they'll go to the 12-month certification period that most children have. We do allow variations of plus or minus 30 days in the certification period. So if you're trying to line up family members so that you don't have that newborn infant on a different cycle than the other family members, you can plus or minus 30 days on that cert action screen. For infant evaluation or child evaluation, those for clients that are certified for 7 months or more, those clients need to receive or be offered a infant eval or C-eval. And halfway through the certification period. So it doesn't have to be on the 6 month on the dot, but when you normally would bring that client in for benefits renewal, you would perform the infant eval or C-eval at that time. If they miss that infant eval or C-eval, they must be rescheduled at least once, but we can't deny them WIC benefits if the eval is missed. So they are certified for that whole period, the certification period, but we do like to midway check and see how things are going as far as the child's growth, any issues that arise through the certification period, and of course to make sure that they're getting the nutrition education or counseling that they need throughout the whole certification. Many people, if they do miss a I-eval or C-eval, just issue 1 month's worth of benefits and reschedule them for another opportunity. So the next thing I wanted to talk a little bit about was the notification of clients' rights and responsibilities, which we do by having the client review the client agreement. This informs the client of their rights and responsibilities in the WIC program. It needs to be read by or read to the client or authorized person at each cert or recertification. The client then needs to review that information and sign and date the client agreement. And again, that happens at each cert and recert, or when the authorized person changes, or when the client transfers into Michigan. We provide a copy of the client agreement at that initial certification, and we offer it at subsequent certifications. So one of the things that we've been looking at is during the management evaluations, is the client being offered that client agreement for them to review? It is something that changes periodically. You're going to be seeing some changes coming up with the compliance policies, and so the client agreement will be changing as well. The client needs to be aware, what are the rights and responsibilities? They can't sell WIC benefits. That's not, that's something that is something that they can be penalized for and even fined or taken off the WIC program, sanctioned for. So they need to be aware. They need to know what their responsibilities are. And so making sure that people are aware is keeping that client agreement in front of them so that they can review it. And sometimes clients will say, oh, I've read that before. And you say, yeah, but we've made some changes, so we want to make sure you're up to date. So it is something that we do need to make sure that clients are aware of. And we do have that available in Spanish and Arabic as well as English. I wanted to also talk a little bit about the verification of certification policy. We do require that the VOC be issued to the authorized person at the time of each certification. That WIC staff have to sign the VOC, and this provides proof of enrollment on the WIC program. Clients transferring into Michigan, we accept the VOC or other proof of current program enrollment from another state or through the WIC Overseas program that's sponsored by Department of Defense. So if a client brings you some information that they're already on a WIC program somewhere, either we can accept that or we can call and verify that that information is correct from the other agency. We also need to be very forthcoming in terms of saying, sure, I can fax or email you that information with a VOC. I also see the client information form is helpful for clients that are terminated off the WIC program, and that just shows the next state that they're not receiving current benefits and what their information was previously. For clients transferring from out of state, the VOC provides the documentation that the client's eligibility has been verified. To move to Michigan, the client brings her VOC or verifies current WIC enrollment and proof of ID and residency, and the Michigan staff performs a transfer out of state using the screen in miscellaneous. So again, we can provide that information, especially helpful for clients that are transferring from another state or if they're in-stream migrants, and again, we can use that information to be able to put them on the program immediately and provide benefits immediately. So what happens if a client is no longer eligible for the WIC program, and how do we provide that information that the client's eligibility is ending? For most clients, the Nutrition Ed Plan provides the notification of end of certification. So for clients that are found income ineligible at certification, well, you know, that doesn't happen very often, but sometimes it does, you need to issue an ineligibility notice. Ineligible notices should also be given under other circumstances, like they're terminated mid-cert for income eligibility. They come in, they tell you that they won $1 million in the lottery. Well, I'm sorry, that's great, but I'm sorry you're no longer eligible for WIC. If you have a client that's been sanctioned, suspended, or disqualified from the program, or a breastfeeding woman who's discontinuing breastfeeding after 6 months, a written notice must be provided and include the client's right to a fair hearing. If you print the ineligibility notice, that automatically prints out when the ineligibility notice is printed. So how do I trigger an ineligibility notice? I have to go to the client information screen, and here I can document the reason for ineligibility from this drop-down. I save that information and can then print out an ineligibility notice. So what happens about that client who wins the lottery or has a significant change in their income? If the client's not adjunctively eligible, if the client has more than 90 days left in their certification period, then again, we want to use the information that they're able to provide us to determine whether or not they're eligible. If they have that current they have current adjunct eligibility and there's less than 90 days in their cert period, we don't really have to do anything. We can provide them benefits and or just terminate them from the program. If you're terminating a client based on a change in income, then you would want to record that termination reason, no longer eligible, on the cert action screen and issue benefits as the system allows. So usually there's a period of notification, and then benefits can be issued during that time. So let's talk a little bit about this whole idea of eligibility within that own source of income. Again, the guidance that we've received from USDA is for determining whether a family is independent or dependent, is that their economic unit must have its own source of income. And then it's up to the local agency to decide whether, given that client's circumstances, whether there's available income is adequate to sustain the economic unit. Adequacy of the income, not whether the unit receives any in-kind benefits, should be the determining factor. So how do we assess the adequacy of income? The actual living and support costs for the economic unit must be in that environment must be considered. So it's hard to be black and white about this. You really have to consider what resources are being made available. I'm getting a chance to stay at my sister's house. She's not charging me any rent. I'm working part-time. I'm paying my own expenses. I have Medicaid. I have food stamps. I have other support. That might be the determining factor as to whether or not that's a separate household from the sister. In that case, with a source of income, with Medicaid, with food stamps or other support, I think that I would consider that probably a separate entity. If you have a client who's receiving, who's living at home with parents, who's under 18, whose family is paying her insurance, paying her expenses, paying for food and other things, and her housing, her clothing, that may not be a separate entity. But if she has Medicaid, again, we can use that as her adjunct eligibility, regardless of what the family's income is. So here again is another example of adequate income. A pregnant client has 2 children, lives in her parents' home. She's has a sibling at home. Client works 32 hours a week at $10 an hour, so she's making above minimum wage, and the client and the children have Medicaid. So what would you think? I think in this case it's probably a situation where there's 2 households living in the same dwelling, and we can count that client as being a pregnant woman with 2 children, so there'd be 4 people in her family, even though she lives in a dwelling with her parents and her sister. So here's another circumstance where you have a pregnant teen, lives in a parent's home. You have the client, 2 parents, 2 siblings, 1 expected infant. The client is working 15 hours a week, and client's on her parents' insurance. That would be a tough call, but probably, once you've delved into it a little bit more as to who's providing food and clothing and other support, that may or may not be an independent client. If she applies for Medicaid and Medicaid is authorized, then again we can count however many are in her family and adjunct eligibility for herself and her expected infant. So here we have a refugee who's coming in from Central America or living with relatives. The client claims 0 income. She does have an emergency-only Medicaid for herself and mom's coverage for her pregnancy. Would we consider her separate from the family's income? Since she's in a refugee status or kind of in she might be on a visiting visa or something like that, she herself has no income. She's supported by her family. But since she has, the emergency-only Medicaid, any form of Medicaid acts as adjunct eligibility, so we can enroll her with adjunct eligibility on the program. So we want to talk a little bit about another issue that arises and kind of impacts eligibility on the program. Have you seen this pop-up occur when you're enrolling a new client, when you're doing a pre-cert? What's it telling you? It's telling you that we have a client already enrolled in the system who has a similar name and the same birth date and gender. So what it's looking at is a way of being able to say, is this person already enrolled on the program? Is this a different person with the same name? What's the scoop here? And so this gives you an opportunity to review that information and say, even though you said you would never on the WIC program before, it appears maybe you've applied for WIC someplace else. So here's the information that we have. You've applied for the WIC program in Lansing, in Ingham County. is this information correct? And this gives you a chance to be able to say, cancel for this new client, so the new information is not current, shouldn't be regarded, or it really is a separate individual, and so we can go forward and continue to certify that client. So if you click on the blue box, okay, we'll create another record, and that client will be able to be scheduled for a certification. If you click no, cancel for that client, then you can bring up a more comprehensive search and find that client and provide them with additional services or whatever they need to go forward. So what happens if I do look at, or I do identify, or the system identifies a dual enrollee? The list is checked for WIC and Focus Hope enrollment each Thursday. So that's part of that overnight process that happens Wednesday night. So you'll have actually a new list of dual enrollees every Thursday morning. And in terms of resolving that information, you do need to go to the miscellaneous screen, and you'll click on and resolve dual enrollment. And again, this process, I had some great screenshots here to be able to do this, so I apologize for them not being active. But you'll go to that miscellaneous screen and be able to make that resolution. For some circumstances, once you've resolved that, a note will go automatically into the client's record saying what has happened in terms of the resolve. Once you've made that resolution with that other record, that will not pop up again. So in terms of what happens to that client, again, you can make that determination. So there are different options when you're resolving the dual enrollment process. And so we have investigate, resolve different client, resolve duplicate client, block this record that's on the right-hand side, and the record on the other side of the screen will be kept. If you have a resolve duplicate client, keep, that client's record is more current on the right side of the screen. The other one is either not current or has never been authorized or something. And these are the two most common resolutions. And then resolve other means that there's some other circumstance that's involved. We don't see that one very often, and we shouldn't probably. We put it in there because we couldn't imagine what wouldn't be these first four, but something always comes up. We don't click on investigate unless the information that you look into in the client record when you're looking at the list of clients that are presented to you for dual enrollment would indicate that both of them are enrolled. They're currently enrolled. Both clients are currently enrolled. The information is the same or similar. That leads you to believe that it's the same individual. They're enrolled in two different programs. There's an active certification, and that they have received active benefits during the same period. So that's what we mean by actually a dual participant, is that a client is receiving benefits from more than one clinic, more than one agency. And this can also happen with a CSFP or Focus Hope program that's in your area. So I'm sorry I can't show you that resolve screen, because that would probably help to make sense out of this whole process. One of the things I want to point out is on every screen, even the ones that you use or that you don't use frequently, there's a little question mark up here in a white circle. And if you click on that, it gives you the help screen for anything that happens on this screen. So that's helpful if you're looking at something like dual enrollment, or might be some other process that you don't do very frequently. You can pop up that question mark for that screen, and it will provide you with the help information. If you do click on investigate, if you decide that this client, yes, is probably a dual participant, you click on investigate. What happens is that it'll say, are you sure you want to click on investigate? And if you say yes, then also what happens is that it creates a compliance record for that client, for both of those clients. So that forces then the coordinator to look into that more thoroughly and document whether or not that client is truly a dual participant. If you have a client who appears to be duly enrolled on two different agencies, that may take a little bit of, or it will take coordination between those agencies to make sure that that client is indeed receiving benefits at both sites, which is the criteria for dual enrollment or dual participation. For dual enrollment, I can have the same name, or it could be inadvertently put in as a dual participant, that someone did a pre-cert on this client and didn't do a statewide search, disregarded that first little orange box and put somebody on, and that happens all the time. And again, if you're doing that statewide search, if you're looking for the authorized person, making sure that they're not in the system more than once, that helps to prevent dual enrollment from happening. I wanted to talk a little bit about something that I mentioned at our WIC coordinator meeting last year. At the two-day coordinator meeting, we identified some records that of clients with very high incomes. And I notified some local agencies who had listings earlier this year, and just to kind of make them aware that this is happening. And what I did is I ran a predefined report. Again, I go under miscellaneous, go into predefined report, and I'll give a little bit more information on that here in just a minute here. Oh, wait a minute. Okay. So I want to mention while I have you that we have some future webcasts coming up. On October 15th, we'll have our MyWIC release webcast. And that should be very interesting since we haven't had a release in almost a year. And also some new policy on MyWIC security will be discussed on October 22nd. So some new things that are coming down the pipe. I wanted to talk a little bit about one of the things that people have asked about is there a proper way to record names in MyWIC? And one of the suggestions that we had from local agency staff was that we use the same process that MICR uses to record client names. And this will help with linking to the MICR record and will provide us with a consistent process. Now, this is not WIC policy at this point, but I wanted to share with you what the MICR rules were, and your agency can discuss and implement those rules if you see fit. What I see though is some sloppiness and a couple things that we would definitely recommend. If you have a client who has a common name, Mary Smith, Mary Jones, Maria Rodriguez, a middle name might be very helpful, middle initial might be very helpful for that client so that you don't mistakenly open up one other record. Also, in terms of capitalization, we should be using capitalization conventions in names and addresses. This is just common courtesy. We provide publications and notifications for clients, and to me it looks really sloppy if I get Mary Jones with all lowercase Mary, variously, whatever. The system doesn't automatically make those changes, so whatever you put in the system is what gets printed out on notification, which to me sometimes looks kind of sloppy. Anyhow, the MICR rules include for the patient's name, the client name, the last, first, and middle initial characters must be alpha only. The last name or the first name should not include the patient's suffix like junior or the third. The first name should not include the patient's middle name or middle initial. No numeric or what do you call those? Character characters like hashtag or ampersand, and no invalid names like baby. So you wouldn't want to put Baby Jones in, even though the client at that point in time is calling you from her hospital bed and saying, well, we haven't finalized the baby's name yet. If you can ask her if she can provide you with what the current favorite is, then we can at least have an appointment for Arthur or Sydney or Sarah Jones, at the time of the appointment. Then she can tell us whether or not that's the current name for the baby. So getting back to the clients with high incomes, I wanted to make sure that one of the things that we're looking at is to make sure that the client's income information is accurate. We're determining income eligibility, and sometimes we can use that adjunct eligibility. Sometimes clients are over income, our income guidelines based on being maybe someone who's in children's special health care or has been hospitalized or have some other reason why they would have an income. But if I looked at this, an hourly income of $815 resulting in an annual income of over $100 million or over $1 million, I would be concerned about seeing that in a client's record. This client has, we're reporting to USDA and Congress that this client has an income of $1.65 million in the WIC program, determined that they were eligible for WIC. If I got that information even on a irregular basis, I would go, what are they doing? So even though you have determined that a client is adjunctively eligible, you're putting in the information, click on that Show Income Eligibility. If it exceeds, then you can look at that information and see, is this plausible or not? Is this wacko? Obviously this client probably did not have an hourly income of $815. So we want to try to make sure we're recording the information accurately, because it doesn't affect this client's eligibility, but it affects our credibility within the Michigan WIC program. And certainly if I were a congressperson and I was looking for fraud and abuse in the WIC program, I'd really question whether or not we should have clients enrolled with $1.6 million reported income. So how do I search for those clients? If I'm a coordinator, I have access to the predefined report. If I go to client to clinic, I go to miscellaneous, I select predefined report. It gives the screen that says different options, and I select the client listings, the agency or clinic that I'm working at, and then I scroll through and find screen 3. Here I see where I can report. I can look for clients who have an annual family income, and I just arbitrarily picked $100,000 as being a top income because, again, not too many of our clients are income eligible for the WIC program and have an income over $100,000. And then the maximum amount of income, I just put 9999999. So, and then I put in arrow key through, and I have to put in a title, and I just title it whatever I want, but I can say high income and then click submit. And this is the report I just did the other day. I have 4 pages of listings. It's actually 3.5 pages of listings of clients, and you can see that there are clients from almost every agency, and we have clients who have incomes of over $100,000, $200,000, $300,000, $1 million that are on this list. And to me, even though the client is adjunctively eligible, the veracity or the information that we're reporting as far as the income is concerned is suspect. So I really appreciate if you run these reports, look at the information. If you're seeing that as a consistent issue with a particular staff member, you may want to be going back and asking that staff member to click on that eligibility button so that they can double check their income eligibility and make a difference. So I don't know if we've received any of your questions. If you haven't submitted them, please go ahead and do that right now. And we want to make sure that we have time to answer questions during this time. Okay. If they don't see the question bubble, you need to refresh your browser. If you click on F5 on their keyboard, that will refresh the screen and allows you to see the question bubble. At this point, I'm going to take a quick break, 5 minutes, and we'll be back at, well, actually, why don't we go ahead and come back right at 11 o'clock, and we'll go ahead and take any of your questions at that point in time. So thank you very much for your attention to this point, and we'll give you a few minutes to submit your questions, warm up your coffee, and come on back at 11 o'clock. Thank you so much. Okay, now we're back. We got quite a few questions, so I'm excited about that. I do want to make sure I've got the information correct on the releases and the upcoming information. The release webcast will be on October 15th. The actual release for the MyWIC update will be on November 6th. So again, Thursday, November 6th will be the release. As usual, we'd like to have you, if at all possible, shut down at 5 o'clock so that we have time to get that release all situated for Friday morning and be ready for that. We also have a security webcast coming up on the 22nd of October. And again, you can sign up for those going to the MPHI website. So appreciate that. Also wanted to let you know that we do have current income guidelines available for Arabic, Spanish, and English. And so you can order those. They've been updated for 2015. I know it takes so long to get these updated, and I apologize for that. But because of the translation issues, it's somehow always an issue. I want to just share with you again the income calculation guide sheet. Again, you can go to the policy 2.05 and you'll see this posted on the website. So again, you can print that off, have that information right at your desk side. So as you're making appointments and talking to clients, you have that information right away. So let's get to your questions. Great questions here. A couple of things. One is from Afton and Inacare talking about self-employment. I believe in policy 211 states that if a client is self-employed, we can use their adjusted net income instead of gross. Please explain this. And basically what USDA is recognizing that with farm families or with families that have self-employment income, that there are, if you're reporting all the income that you get, that's also the expenses that the business has generated, all of the travel and equipment purchases that have been made. Those kinds of things really don't result in income as far as the family is concerned. So it really comes down to taking those things off, and that's what they do when they talk about adjusted net income, is that really on your 1040 form, that's what you paid yourself, and as being a family that has a self-employed person for many years, you look at the gross income and you're like, holy cow, and then how come I don't have that money? And it's because you have all those expenses. And in my case, it was those tools that were required for my husband, who's a carpenter. Tammy from Community Action Agency asked about if a woman has a boyfriend and that is living with her, is the boyfriend's income included in the determination? And again, it's really asking her, what is her situation? Who is she financially responsible for? What sources of income are available for her household? So she can tell you whether or not she has access to her boyfriend's resources, income, that sort of thing. It could be that he's paying the rent and doesn't give her any other support, that she provides support for her children and herself. It could be any circumstance. So whenever there are unmarried people together, whether it's family, whether it's boyfriends, whatever circumstance, usually that takes some other kind of delicate probing. But I usually just suggest that you ask, tell me who's in, the number of people that are in your family, and tell me what your income sources are. It's up to the client to provide you with that information. Afton had another question from Intercare about pregnant women income. If we certify a client as pregnant on the program and then 2 weeks later she miscarriages and we reassert her, do we have to check income again since it's within 30 days of the first time we checked income? Every time you do a cert or recert, income has to be redone. The system doesn't have a 30-day rule. It has a today rule, and so you have to complete the adjunct and the income information on that day. And it may be the same, so in which case you just put in your verification information and make sure that it's accurate. That's all we can ask for. Joanne from Downriver had a question about projecting unemployment. If you have a client who's recently unemployed and unemployment benefits are pending, how should we project for the next 30 days? So again, here is where we ask for clients who've had a sudden change in income. What we can do is say, tell us what you anticipate your income to be for the next 30 days. And if she says, I don't know, I'm not getting any income right now, then you can use zero income for the time being. And again, you know, you want to make sure that you're offering her what other resources are available for a client with zero income, even though you know that she may have be entitled to and receive unemployment benefits in the future. So for sudden changes in income, whether it's strike pay or unemployment or whatever, if the client understands what she can or anticipates what she's going to be receiving, then that's helpful. If she doesn't know or hasn't received anything, then you can put zero income, and that would be reflective of what she's anticipating. Joanne had another question about pay stubs. This is a good one. If a client brings only one pay stub as proof of income and she's paid weekly or biweekly, can we use the year-to-date option, or should we provide a short certification? Especially critical if client's not adjunctively eligible. If the client doesn't have a month's worth or 30 days worth of proof of income, we can use that 30 day, or the year to date. So if they've worked more than 30 days, you have more than 30 days of information. That's what USDA is really interested in, is that they're not bringing in, you know, one pay stub that's $14 because they were on unpaid sick leave or something like that, when they really make, you know, $900 a week or something like that. So that's what you have to look for, is, you know, what information. Another agency came up with the brilliant idea of being able to say, okay, you didn't bring in your proof of income or your proof of ID or whatever. If you have a smartphone, that you can take a picture of that client's income when you get home and text or email it to us, then we can use that information as proof. So that's another way that you can try to eliminate or minimize the number of short certs that kind of go lingering out there, where a client may end up without benefits for a period because they didn't provide you with that proof. So if they only have one stub, if you have more than 30 days worth of information from a year to date, then you can use that information. If they don't have that, if it's a brand new job, they just have that one pay stub for a weekly pay, or they only get that information on a weekly basis, they may be able to text that information to you by taking a photograph of their other pay stubs. If the client doesn't get a pay stub and they're getting an electronic pay stub, that's how the state does it. I never get a pay stub. I have to go to the website and make or to get a copy of my pay stub. Again, if they can provide you with that proof and show it to you on your phone, you can bring it up on your computer. You're good to go. That's sufficient proof. Jennifer had a question from Shiawassee on temporary low income. Can you discuss this further, how it's used and what should be documented in this case when they may not have any proof? Again, like we talked about just a few minutes ago, that if the client comes in and says, I've been laid off, or my husband's on strike, or whatever, that has generated this temporary change or immediate change in their income, then we have to just ask, you know, what information do you have? Do you anticipate that, do you know that you're going to get X many dollars in the next 30 days? If they have that information, then we can use that. If they don't have any proof, then again, they may have to submit an attestation, or have you sign an attestation form. If they're saying, I really have no idea, or, you know, the situation was I was working for cash and that job is no longer available to me, I'm not going to have proof of anything. So again, then I can either use an attestation or self-declare that I have zero income. Melissa from Shiawassee asked about proof of ID for a foster child. I know that sometimes foster children come to you with very little information if it's been an immediate kind of circumstance where the foster family has received the child kind of in the middle of the night kind of deal. And her question is, when certifying a new client who's in foster care and has never been on WIC, can we accept the foster parent's DHS medical authorization card as proof of ID? It has the child's name on it. Anything that has a child's name on it can be pretty much used as proof of ID as long as it was generated by the state. So that's very helpful to have that information. If the foster parent for some reason has a copy of the client's immunization record, that again can serve as proof of ID. If the client's been on the WIC in the past, again, she's provided her proof of ID in the past, and so we don't need to have that to be able to initially put her on the program. Anna from Intercare is asking about a signature for the VOC. Can any WIC staff sign a VOC? Also, can just VOCs cover an identity proof? The first question answer is yes. Any WIC staff can sign a VOC. Basically what you're verifying is that yes, this client is currently eligible and receiving benefits from the WIC program. And according to our ID policy, if a client presents a VOC, that does provide the authorized person with ID proof. So again, that gives us a way of being able to enroll a client immediately on the program as they're coming to WIC. Afton had another question from Intercare about VOCs. Just to clarify, we only have to provide the VOC at a recert or a cert, and if requested by the client. It does not need to be given at C evals and I evals. We just double check the policy on that, and that is correct. So that if you're certifying a child and there are other children that have fallen off the program in terms of no longer current, you may want to generate a current VOC, but that is correct, that it is required at cert, recert, and if the client requests, and otherwise it's up to the agency to provide that. Mom's adjunct eligibility, and that's the Mom's program. If Mom's income requirement is 195 and WIC is 185, why are Mom's clients adjunctively eligible? And the answer is that the Mom's program is a type of Medicaid, and according to our WIC policy, if you have any type of Medicaid, even if it's a restricted type Medicaid, then you are considered adjunctively eligible for the WIC program. So we have that opportunity to be able to enroll that mom on the WIC program, even though the income requirements for the Mom's program are different. So I hope that's answered your questions. I just have one more thing I want to share with you. I'm going to be retiring in the next week. As of September 30th, I'm going to be retiring. So our new pal in the eligibility area is Heather Kahn. Many of you know her, and so she's going to be taking over this area in terms of policy, and hopefully answering your questions as they come along as in terms of WIC eligibility. I want to make sure you have her information, and again, you can always contact the WIC de jour at 1-800-WIC-1636. Press 1 and 2 and ask for the de jour. If it's something particular to income eligibility or some of the things we've been talking about today, you can also contact Heather directly. If you have, and again, thank you so much for your attention today and for all that you do in the WIC program. It's so incredibly important what you have, what you share with your clients, and the services that you provide. Thank you again for your time today.